at the end of this lecture, you should able to define what is a granulomatous inflammation. You can recognize the morphology of granuloma and list the cells found in granuloma and their appearance. You can describe the pathogenesis of the granuloma formation. You can describe two types of granuloma differ in their pathogenesis. One, the foreign body granuloma. Second, the immune granuloma. You can list the common causes of granulomatous inflammation. Inflammation actually is a response of vascularized tissue to the infection and to the damaged tissue. It brings out cells and molecules of host cells defense from the circulation to the site where they are needed to eliminate the attacking or offending agent. In acute inflammation, whenever there is an offending agent, the first cells that come to combat, that is the neutrophils, that is called acute inflammatory cells, result in they come first combat. If thing is still present, that leads to the chronic inflammation where these macrophage, lymphocyte, plasma cells, they play their role whenever there is any tissue injury and inflammation occur. As you all know, the acute inflammation have got a very short history. The clinical and signs of the inflammation are present associated with these constitution syndrome. If you see the microscopy, you will find a vascular changes, exudations of fibrous fluid, presence of large number of neutrophil cells like fibroblasts, histiocyte, plasma cells are present at the site of repair in case of acute inflammation. In case of chronic inflammation, which is due to the persistent infection, and it is a response for a prolonged duration which inflammation, tissue injury, attempt to repair coexist in varying combination, like in a hypersensitivity disease, in prolonged exposure to any toxic agent. Microscopic appearance, like if you say chronic ulcer, like a chronic peptic ulcer of stomach, chronic abscess cavity, like in osteomyelitis, thickening of the wall of the viscous, like usually like in Crohn's disease and chronic cholecystitis, granulomatous inflammation, and in fibrosis. On microscopy, you will find there is a proliferation of connective tissue and blood vessels, presence of lymphocyte, plasma cell, and macrophage. In many cases, small area of necrosis may be present with process of repair marked by fibrosis. Neutrophils are scarce or in case of chronic inflammation. Granulomatous inflammation. Granular formation is a protective response to a chronic infection or presence of a foreign material. It isolates a persistent offending agent, prevent it from dissemination or in spreading and restricting the inflammation. This protects the host. So this is a protective mechanism. Granuloma can be defined as a circumscribed lesion of about 1 millimeter in diameter, composed predominantly a modified macrophage, rimmed at the periphery by a lymphoid cell with a collar or fibroblast proliferation. Granuloma, actually this is a nodular collection of epithelioid macrophage surrounded by a rim of lymphocyte. Epithelioid macrophage look like a squamous cell-like appearance. Why it is important? Granuloma encountered in certain specific pathological state. Recognition of granular pattern is important because of limited number of conditions, some life-threatening, that cause it. So we recognize the pathology by recognizing granuloma in that specific pathological state. Granulomatous disease, the most common causes, we talk about the bacterial, then tuberculosis, leprosy, brucellosis, salmonellosis, dysbiosis, encephalitis, in Q fever, a list. In the fungus, in the histoplasmosis, blastomycosis, coccidioidomycosis, hypersensitivity pneumonitis, in helminthitic infection, cystosomiasis, and trichinosis, in foreign body type, it usually occurs in the silica granulomatous and foreign body pneumonitis. In viral calamidalitis, it usually occurs in a cat scratch disease, lymphoma granulomarum. In mental induced, it usually occurs in a berylliosis or zirconium granulomatosis. Unknown causes of the granuloma formation is sarcoidosis, Crohn's disease, Wagner glomatosis, giant cell arteritis, rheumatoid arthritis. We will not discuss all of the diseases. We will discuss few diseases in which there is a granuloma formation. So come on, formation of granuloma. So whenever there is a cell injury due to any agent, so its failure to digest that agent, weak acute immune form, response, engulfment by macrophage, persistence of that injured. So weak inflammatory response causes T cell mediated immune response, poorly digested activation of CD4 T cell, activating of the monocyte chemoprotective factor, result in the macrophage are activated by interferon by accumulation of tissue macrophage, result in the epithelioid giant cell, fibroblasting proliferative cell, result in the granuloma formation. Cytokines are formed by the activated CD4 T cells and also activated by macrophage. Cytokines, interleukin 1, interleukin 2 causes the proliferation of T cell, interferon Y cause the activation of macrophage, tumor necrosis factor alpha cause the fibroblast proliferation, activate endothelium, growth factor causes the activate tumor growth factor. Composition of So if we talk about the composition of granuloma, it composed of the caseous necrosis or caseous material. Then it contains the activated macrophage, the giant cells which contain horseshoe-shaped type, and then a rim of lymphocytes surrounded it, and in then at the periphery there is a fibroblast. What are the epithelioid cells? These are actually cytoplasm macrophage become large, polygonal with pale oval nuclei and abundantly cloudy eosinophils. These are called epithelioid cells due to resemblance with the epithelial cell. Opposing cell resemblance of epithelial cells exhibit a high degree of interdigitation. Macrophage can become epithelioid cells. So there is no phagocytosis, complete phagocyte, the material extruded phagocytosed material by exocytosis. So this is a epithelioid cell that you are seeing. Giant cell. What is a giant cell? When macrophage encounter insoluble material, they call to form giant cells. Mostly non-proliferating macrophage fuse in this manner. Foreign body giant cell, large number of nuclei, around 50 to 100, regular in size, scattered in cytoplasm, and they are found usually in the suture or hemorrhage or atheroema. Langan type, the nucleus are arranged around the periphery like a horseshoe. And this usually occur in Langan type in tuberculosis, leprosy, and syphilis. Tauten's giant cells you will find in xanthomas. The cytoplasm and the foamy or vacuolated appearance. If you recall your mind in last my lecture when we are on the accumulation, intracellular accumulation. So I gave you one of the examples when there is accumulation of fats in the cells, especially in the skin. Then this length formation. Osteoclast giant cells, Escoff cells, tumor giant cells, virogenic giant cells, these usually occur in different pathologies. So inflammatory giant cells, one is a foreign body type, another is a Langan type, C is the Tauton type. So tumor giant cells are anabolic tumor giant cells, redistributed cells that is usually occur in the Hodgkin lymphoma, mirror out-shaped appearance, osteoclastic giant cells. So this is the giant cells that you are seeing. Again, a high power field vision. Lymphoid cells, cell-mediated immunity reaction to antigen. Lymphocytes are an integral composition of granuloma. Plasma cells are indicative of accelerated immune response. Necrosis, feature of some granulomatous condition. In some granulomatous condition, inside the granulomas, there is a necrosis usually you find. Also, a fibrosis, whenever this is a feature of healing by proliferating fibroblasts at periphery of the granuloma. Types of granuloma. So, foreign body like talc, suture material, necrotizing granuloma that usually occur in Mycobacterium tuberculosis, Histoplasma capsulatum, granulomatous, non-necrotizing granuloma, Mycobacterium leprosy, Sarcoidosis, and SLE, suppurative granuloma, histiocytic response, uh, no granuloma formation, and the Listeria monocytosis, mycosis, and fungal. Foreign body granuloma, relatively inert foreign bodies. Absence of T cell mediated immune response in this foreign body type granuloma found around materials such as talc, suture. They do not incite any specific inflammation or response. Foreign material can be identified in the center of granuloma. This point to be noted. Viewed with a polarized light, that is refractor light. I will show the slide. So this is a refractor light in which foreign body is identified in the center, forming granuloma. Again, this is a polarized light in which that is showing a foreign body type. Immune granuloma, variety of agent inducing persistent T cell mediated immune response. It is usually seen when the inciting agent is difficult to eradicate. Tuberculosis. So this is a slide in which you are seeing this purple color, the Mycobacterium lepro, that's showing that tuberculosis is there. Hypersensitive immunity play a major role in development of lesion. Tuberculosis bacillus does not produce any toxin. Tissue changes seen are due to host response to the organism. Type 4 hypersensitivity reaction. Host responses are due to several lipids present in the organism. On microscopy of the tuberculosis, this is seen, which is taken from the site of active involvement, marked characteristic granulomatous inflammation, both caseating and non-caseating tuberculosis formation. Granuloma are enclosed by fibroblastic rim punctuated by lymphocyte. Multinucleated giant cells are present. Immunocompromised plate do not form a characteristic granuloma, so their macrophage contain many bacilli. So this is a picture of typical well-defined granuloma in which the central caseated necrosis one can find arrow marking surrounded by giant multinucleated cells or ligand type, and after that there is an aggregation of epithelioid cells and there is a collar of lymphocyte or plasma cells. So they have rounded out lines. So the localized small appearance of these granulomas suggests that immune response is fairly good. Again, the site where the tuberculosis occurs from where histopathological slide is taken. Again, another high power field showing caseating granuloma surrounded by epithelial ligand type of giant cells which are horseshoe appearance. Syphilis. Syphilis is the sexually transmitted disease caused by the Trypanosoma pallidum in by gram-negative spirochetes, slender coccus it have got appearance. So, see, this is a slide of the Trypanosoma pallidum. Pathogenesis, proliferating and arthritis affecting small vessels, surrounded plasma cell infiltrate. Pathology, ischemia produced by vascular lesion. Pathogenesis of end arthritis is unknown, is a lytic vasculitis. Chronic inflammatory granuloma with syphilitic arthritis in small vessels, dense infiltrate of plasma cell with scattered macrophage and lymphocyte proliferate and arthritis, endothelial cell activation and proliferation and progression to intimal fibrosis, lymph node plasma cell rich infiltrate or granuloma formation. In secondary stages of the syphilis, which start usually after 6 to 10 weeks after development, that we call canker, generalized symptoms are earliest skin eruption, rosellar rash, macular syphilis, papular squamous syphilitis, and pustule formation. So see here, this in center this is a granuloma formation in the tertiary stage. There is a gumma formation, which are found in the cardiovascular, syphilis, and other areas of body. So destruction of the tissue, focal granuloma with tendency to central area of necrosis called gumma, diffuse inflammation with fibrosis of and a zone of central necrosis surrounded by fibrous tissue, wall of vessel are thickened by end arteries obliterated surrounded by the inflating cells. Same high power field view of that slide. Sarcoidosis. Actually, this is a systemic disease of unknown etiology characterized by hard tubercle-like granuloma formation, chronically stimulates like a Hodgkin disease, lesion, regional and mediastinal lymph node lesion usually occur in the mediastinal lymph nodes, lungs, spleen, liver, eyes, parotid, skin and bones. Mediastinal lymph nodes are involved in 75% of cases. If we talk about the pathogenesis, exogenous or autologous antigen stimulate and it exaggerate helper T cell response, result in the T cell accumulate in affected organs, it secrete a certain line of lymphokines, cause the recruitment of macrophage over there, result in the non-caseating granuloma formation. It appears the sarcoid tissue is fairly grey in color, form discrete and confirmed masses in lung, mostly at the mid-zone and basis. In bone, it usually forms a small cyst. In skin, it forms a lipus perino or soft inferior vesicular papules. See in the lungs how it looked like the sarcoidosis, gross. On microscopy, discrete granuloma with plump endothelial cells and few Langerhans giant cells are seen. Few giant cells contain star-shaped acidular body or estuary body that we call lipoprotein. Schumann bodies, non-specific end product of active metabolism and secretion that take place in the cells. Again, this is the slides. Mycobacterium lepro, that is called leprosy. Lepro taken up by the macrophage, disseminated in the blood, proliferate in relatively cool tissue, secrete no toxin and its virulence is based on the properties of cell wall. These are the Mycobacterium leprosy forming the granuloma. So lepromatous, it involves skin, peripheral nerves, upper airway, testes, and hand and feet. Include symmetric skin thickening and nodules, widespread invasion of mycobacterium into Schwann cells, and endoneural and perineural macrophage damage, peripheral nervous system, macular, papular, or nodular lesion forms on face, ear, wrist, and elbows. They cause to yield a distinct lesion, lesion faces, diffuse involvement of symmetric and neuritis. So in this leprosy, there is a on microscopy, if we taken from the slide, the large lipid-laden macrophage, lepra cells filled with mosses, there is a globi of acid phosphobacilla, abundant bacteria, multibacillary leprosy. So you will find a granuloma that is lepromatous lepro. In Crohn's disease, which is the inflammatory bowel disease, you will find morphological multiple separate sharply delineated areas of skin lesions. Earliest lesion that found in the mouth, that epithelioid, progress and coalesced into serpentine ulcer along with excess bowel. Actually, edema and loss of normal texture, cobble appearance on the morphologically, and creeping fat usually. This is the fact there is a cobblestone appearance and a creeping fat. On microscopy, non-caseating granuloma are the hallmark of granular disease. Granuloma may also present in mesenteric lymph nodes. Caseatinous granuloma form nodules, that is a metastatic Crohn's disease. In active disease, abundant neutrophils that infiltrate the damaged crypts and epithelium. Crypt sepsis, cluster of neutrophils within the crypts. So epithelial metaplasia, consequence of relapse injury. So there is a crypt abscess and caseating granuloma that can be seen histopathology in disease. So this is a diagrammatic view in which there is a hyperplastic lymph node, linear ulceration, perforation, abscess formation, lymphoid follicle, granuloma formation. Uh, in histoplasma capsulometer, this is a dimorphic fungus infection and small over yeast-like 1 to 4 cubic microns. Primary usually occur in the lung, transient infection with highline lymph nodes involvement, rapid healing with residual calcification. Organ from travel in bloodstream goes to other sites like spleen, liver, uh, and other organ. So this is a dissemination. Leads to involvement many other organs with mononuclear phagocyte So this is a fungus formation in histoplasma capsulatum. So on microscopy, necrotizing granuloma in lungs, mediastinal lymph nodes, spleen and liver. In early stage, it causes caseal necrosis, is surrounded by macrophage, Langerhans cell, lymphocyte and plasma cell. Yeast form can be demonstrated in the macrophage. Eventually, the cellular component of granuloma largely disappear with caseous material, calcify and finally form fibrous calcium material. This is seeing that you are seeing, and the yellow marking the fungus. So with this, we have completed a granuloma formation. What is a granuloma? What the pathogenesis?